It's not just a challenge with obesity or just having a higher BMI. You could be very slim and still have it.
Well, that's the thing, right?
That's a misconception that people may have.
Mary, so as you know, diabetes is a progressive endocrinological disease, meaning it gets worse over time and it can affect organs like your heart, your kidneys, your brain. And it's Type 2 Diabetes Awareness Month. And I would like for people to recognize that you can catch this condition early and manage it extremely well, and then worry less about it being a progressive disease, right? So if you can know early enough, catch it before you even get pre-diabetes, you can get to the point where you don't need to ever worry about the consequences of losing your vision, which people talk about for type 2 diabetes, and kidney dialysis, or, heart attacks and strokes from it as a consequence. So I think it's really important to know that you can stop it in its tracks by awareness. Does that make sense?
100%. And, I'm acutely aware because both my parents are type 2 diabetics, and I'm in a position, I'm, 56 next month, whatever. I'm going to be 56. And the whole point is, it's like, I've kind of caught it. I know I have a big disposition because when I eat processed foods, like within 15 minutes, I just really want a nap. Like I have to close my eyes and I want a nap. And so I know that it's real and it's genetic, and there's, this environmental thing that's going on. So if I don't take care of it, and we'll go and do a deep dive about, what is there to do? What are the top 3 treatments that can help you so that I don't have diabetes? At least I'm not diagnosed. Things are looking totally normal. But if I don't take care of it, 100%, it'll come up and show up as type 2.
Right. It's a condition of modern society because of the sedentary nature. People are all stuck on computer screens or spend too much time working. And then, of course, worse than that, the processed refined carbs and abundance of sugar everywhere. You're standing at the grocery store and what do you see? You see chocolate bars, and, unless you're walking on the outside aisles of the grocery store, it's all packaged goods that are often very rich with sugar, flour, and refined carbohydrates. So it's an uphill battle for people who have type 2 diabetes a little bit, because they're kind of often stuck in this place of not wanting to refuse sugar and carbs from friends and family who say, oh, look at this delicious pasta meal that I made, and, have some. And people get a little bit, taken aback when you say, no, I'm watching what I'm eating because I have pre-diabetes or I'm at risk for type 2 diabetes. People are like, no, have some, so it's a constant awareness and nutritional mindset to make that shift to say, okay, I'm at risk and now I need to make some changes to prevent it from, causing issues later. Some say the only way to manage it is through medications, in addition to the lifestyle changes like healthy exercise and levels and frequency and healthy nutrition. And then eventually insulin when the medications stop working. But that's not totally true. In fact, it's false. Medications aren't always needed. And the best thing you can do is catch it early and prevent it from getting to a place where your insulin, the hormone, is not communicating with your insulin receptors, which I can go into in a bit, because it's not just about what to do when you find out you have pre-diabetes or type 2 diabetes. It's catching it early, treating it, but screening for it early, for example. So before we jump into screening for type 2 diabetes, I just want to mention, we can go through more detail on this in another episode, but what are the top 3 treatments that might be helpful for type 2 diabetes prevention if you screen and find out you have. So number one would be...
Before you do that, though,
yes.
Before you do that, let's just very quickly say, hey, we're going to go do a deep dive with this. And if you like our content, please subscribe to our YouTube channel or our podcast channel, which is My Fertology. And you can certainly find all of our goodies on our website, which is myfertology.com. So back to you, Tanya.
Thank you. Yeah. So top 3 treatments would be to, number 1, intermittent fasting, follow a pattern of eating where and your pancreas get a break. And we've talked about this in previous episodes, and we can go into more details about what this looks like in another episode. Another second tip would be to follow a high protein, low carbohydrate, healthy carb type diet with abundant greens and good fats. And the third thing you can do is add more movement into your life, and you can take a 20-minute walk after eating throughout the day to help you with improving the communication between your insulin hormone and the receptors. And adding strength training is key as well. So into that extra activity. So we'll go into more. What does that
mean? What does that mean when you talk about the communication between?
Yeah. So let's talk about that now. So those are kind of like the top 3 treatment tips. I just wanted to kind of brush over them so that people know, when I start talking about insulin resistance, there are things you can do. More important than treatment right now is catching it early. So how do we do that? Well, first of all, we have to know, are you the kind of person that should be screened? Because not everybody should be screened for insulin resistance. There are scenarios where you are more likely high risk for type 2 diabetes and insulin resistance, which is the 2 steps before type 2 diabetes. One of them is looking at family history. So if one of your parents or relative, first degree, so sister, sibling, brother, has type 2 diabetes, you would be a good candidate to look at your own blood sugars and insulin resistance. Feeling tired after eating a carb-rich meal, perhaps the couch is eating you, jokingly, like you just feel like you want to just pass out after eating rice or pasta and you're so tired, that would be a time to screen. Perhaps you're having stubborn belly weight, could be a sign that you're struggling. Gestational diabetes. So let's say you have a history of being pregnant and you are diagnosed with gestational diabetes. You're not totally clear out of the water. You may need to screen later on, especially if you are struggling with difficulty losing weight, so non-pregnant. You're having a hard time or perhaps easy weight gain and or struggling with obesity. So it can impact fertility, but wouldn't be a reason necessarily to screen.
When we are trying to conceive, though, you want to make sure everything's all the ducks are lined up in a row, right? And if there's family history of diabetes, maybe it's something that you would want to test when you're trying to conceive.
Yeah. So if you have noticed perhaps that your menstrual cycles are irregular and maybe you've been diagnosed with polycystic ovary syndrome, it might help to test for insulin resistance before trying to conceive, because it could impact your quality of your eggs if you're consuming foods or have a lifestyle that's now impacting cycle lengths and your fertility. For sure, that makes total sense that you would want to screen, especially if your doctor has said, oh, there's no risk for type 2 diabetes, your blood sugars look excellent, but you're trying to figure out, why am I having a hard time losing weight? Or why are my menstrual cycles, 40 days apart and I can't seem to get pregnant? So definitely that would make sense. So how would one screen for insulin resistance? But before we actually talk about how we screen for it, what is insulin resistance? Let's break it down for a second. So it's this thing that happens in your body before prediabetes. So basically the step before diabetes. It's something that you have to dig deeper for in the world of testing. So it's when your cells in your muscles, your fat, and your liver, they don't respond well to insulin. And so what that means is then your glucose can't be absorbed into those muscles, tissues, organs, as well from your blood. And as a result, your pancreas then says, well, I can just make more insulin to help glucose enter your cells. But then that's not very helpful, because that communication between high insulin and yelling at the little cell receptors, that doesn't make it better. It actually causes your weight to go up, for example, or damage at the receptor site. So understanding that it's basically like your insulin yelling at your receptors, that process happens before prediabetes. And then the next step is type 2 diabetes. So how do you screen for it? There are ways, like let's say your doctor does say, oh, your 3-month sugar average, which is called HbA1c, or the glycated hemoglobin, is closer to 5.5. That might kind of be an indication to plug further and say, okay, well, I want to check my insulin on fasting. So what's my fasting insulin level? If your fasting insulin level is a little bit high and you plug it into a calculator called the HOMA-IR calculator, which stands for IR is insulin resistance, and you plug that and glucose into there, we'll add that into the show notes so that you can do the calculation. If the value is greater than 2.9, it means there's quite significant insulin resistance there. So all you have to do is show up to a lab and do the basic fasting glucose, fasting insulin, take those values and plug it into a calculator. That can tell you if there is creeping, insulin resistance, which again is a step before prediabetes. So sometimes your insulin's working so hard, it's managing your glucose. Your glucose looks excellent on blood work. And maybe even for the last 3 months, your glucose is managed so well that your HbA1c, that 3-month sugar average, is perfect. But you're having all these other symptoms and you're like, why can't I drop belly weight? And why am I gaining weight when I eat or look at a piece of cake? So it could be an indication that your insulin is starting to be working too hard to manage the glucose. And sometimes even that HOMA-IR calculator test will show, oh, I'm okay. And like my level is like 1, for example, or 2. And maybe then you challenge your pancreas by drinking a 75-gram glucose load, and you do the test the test when you go get your glucose reading when you're pregnant. It's called the glucose tolerance test, Mary.
Mm-hmm. Yes, of course.
Yeah. So you drink that orange drink and you wait at the lab for a couple hours and you see your doctor tells you, what is your glucose doing after drinking 75 grams of sugar? Well, this does the same. It analyzes your glucose levels, but it also looks at what is your pancreas doing in response to that by testing your insulin at the fasting level, after the sugar load, at the half-hour level, the 1-hour level, and 2-hour level. So we get to see.
Are people then, okay, so we know fasting glucose, physicians can typically request that, but fasting insulin isn't. So how do you suggest someone go about getting it done? Do they just go ahead and ask their GP? Like what happens?
So it would really depend on the scenario. If they're a fertility patient, for example, and as I mentioned, and you brought it up, which was awesome, perhaps they're struggling to get pregnant and they're trying to figure out, why are my cycles irregular? And you're realizing that maybe this is a test that could be added to screen for insulin resistance. And once you correct that, the cycles start to regulate. And so that would be something you'd bring up with your fertility doctor. Say, hey, can I get my fasting insulin checked? If you're even at a fertility clinic. And if you're not, you can ask your naturopathic doctor. We run blood tests through private healthcare, same labs. It's out of pocket. So it would be privately paid for if your family doctor denies it. So you would ask your family doctor. It's not standard of care. So there would have to be a discussion on why. Because a family doctor is looking at more reactive care. They're waiting for the condition to be, present. So typically in the past, the test that was used for a screen for type 2 diabetes was the fasting glucose. And for years, naturopathic doctors have been using the glycated hemoglobin. That was not standard of care. So there was a nice shift that, over the last 20 years of practice, we could see, oh, look at that. HbA1c is now added in as standard of care in patients who have a high risk to check for the 3-month sugar average. So how much sticky blood do you have, basically, in layman's terms? But so fasting insulin is not on the standard of care yet, but 1 in 3 Canadians are pre-diabetic. How can we prevent that? We can screen earlier for it. So my prediction of the future is that fasting insulin will become standard of care. For now, if you're really struggling with stubborn belly weight gain, or just weight gain in general, or irregular menstrual cycles, as I mentioned, feeling super tired after meals, knowing you have a family history, why not test to screen for it and then be proactive? Testing helps people be motivated And, type 2 diabetes causes, it's like a huge burden on the medical system, like billions of dollars spent on it. So catching it early makes sense. It's sure it costs out of pocket, but really the OHIP and, healthcare companies should cost it. And you can, if you pay out of pocket for tests, you can also include it on your medical expenses on your taxes, so that's another way to save. But
so just to be clear then, so no matter who a person sees for the fasting insulin, it is out of pocket.
It's not out of pocket if you're doing it through OHIP.
So you can get it
Ontario Healthcare. Yeah, if your doctor agrees to it. Yes.
Only if your doctor agrees. But unfortunately, some doctors will not. So, okay, that's very fair. And then the second question to this is, can a person have a regular looking glucose tolerance test? So meaning that everything checks out normal, but then you're going to have fasting insulin be off the chart, or not necessarily off the chart, but just not normal.
So you mean like they just do within that, like just a fasting insulin. So for example, they go in and they say, what's my fasting insulin? And maybe the level is 40. So it's low, you're suggesting. And then they do a fasting insulin glucose challenge second to that to see, yes, that can happen. Because, and it's often in scenarios where someone's being very careful with their nutrition and their exercising. But then they have a big 75-gram sugar load to see, what does my insulin do in response to that? I'm probably one of those people. I haven't gone for the test and I have it booked. But because I have polycystic ovary syndrome, I eat very healthy and very mindful since I was age 30, when my sugary blood was showing up at this test called the HbA1c. The level was 5.7, 5.8, something like that. And when I was pregnant, I did the fasting glucose tolerance test, and my last number on that test after waiting was 2.3. So normal, it should really stay between, like 5.5 and 6.5, or recover to that number, not plummet. But my insulin was probably like, I'm going to take charge and help out with the sugars, right? So, it's not normal to plummet so aggressively unless your insulin's overworking to deal with sugar. Typically, in my life, I try to avoid sugar and flour and eat healthy carbohydrates, which is what I advocate for, so that you have good resistant starches and fiber and good bacteria, and eat lots of greens. But recently I was mentioning to you, I tested with a glucometer just to see, what is my fasting glucose doing after I eat potatoes, for example. I didn't eat protein with that meal. And I just had it with, broccoli, and my levels went to like 7.8, right? So it should really your blood sugar we're talking about blood sugar, should stay between 5.5 and 6.5, which means that then your insulin's not overworking. So if my fasting insulin shows up low, it's because I'm working hard to eat healthy and exercise. Now, if I drank a 75-gram sugar drink, for the test, it'd be like having a pop, right? So then my insulin might be working really hard to deal with it, and my sugars recover at the 2-hour mark. But all the in-between, levels is what we don't see, but you can see on this test. And it might explain, abdominal weight gain in this age of our life between 45 and 55, right? It does explain it. And if you're starting to notice that, it could be insulin belly, right? And stress hormones start to play a role, because your hormones are roller coastering and changing. And then insulin starts to go up because of those changes, and high stress hormones. And so it's a bit of a hormone soup in this stage, and I already have the risk. So I've managed it well so far, and I will still continue to, but I have to tweak things now and test a little further, dig deeper, just to see what kind of needs I have, because I am a woman with polycystic ovary syndrome. It's a big condition that it affects so many organs, including the pancreas, and cardiovascular disease risks. So, at 30, when you're told you have PCOS and your A1C is high, you think, okay, I can manage this. But with age, just like diabetes is progressive, it is, kind of shows up a little bit. So I think as long as you are aware and then you know how to make the tweaks, it's so much easier. And then you feel a lot more on top of the world, I guess you could say, because otherwise you're falling asleep because the couch is eating you after you eat potatoes,
And by the way, for those of you who are listening or watching, it's not just a challenge with obesity or just having a higher BMI. You could be very slim and still have it.
Well, that's the thing, right?
And
So
that's a misconception that people
it
may have.
is.
Yeah.
Like I have a patient who has polycystic ovary syndrome, and she's 29 and she's slim. So she's like probably 120 pounds, maybe 120 pounds, very petite. And she said, I just feel so tired after I eat. I just feel so off. And I said, okay, well, let's check your glucose levels. Totally normal. So I said, let's do the fasting insulin glucose challenge. And her insulin was the highest I've seen. Her glucose was like at 13, insulin's off the charts. I think it was 1500. And I was like, okay, you might have good A1C levels or borderline, but this is serious. And she's making big lifestyle changes and like feels less swollen and better energy. So, it's taking people seriously earlier so that you don't have a lifetime of having to be on medications. It's awareness, it's really important. And so, Dr. Jason Fung did a video on, two biggest lies about, type 2 diabetes, which was interesting. One was, it's not progressive. He says it's not progressive. Most people say it's progressive and that it has to be managed by medications. Well, it is a progressive condition if it's not caught early enough. And no, you don't need to use medications, but sometimes you need, help. So there are ways to get support, and everybody has their limitations on what they can manage too. So I think it's like you have to think holistically. When we say holistic, it doesn't necessarily mean, lifestyle, nutrition, exercise only. Sometimes it is the support. Maybe you need a medication to have the support with the weight loss, you feel better so that you can get on a good lifestyle and then get off the medication. I think we have to think on an individual basis and give people the help that they need by giving the awareness and then getting them to have the ability to do those changes. It's not like no meds, right?
Absolutely.
It's like finding where people are at and treating them in that way.
100%. So then just to wrap things up, the top 3 treatments going back was about intermittent fasting, which is confining the eating and to a specific time frame during the day so that you have a longer period of non-eating. So we did an episode on that, so you can check that out. And 2 was, I'll let you speak to the rest, right? The other 2?
Oh, you were doing a wonderful job. So following a low carbohydrate, healthy carb diet. And what I mean by that is, not restricting carbs entirely, but maybe some plates look like eating 2 green servings. So, asparagus and Brussels sprouts, for example, with your protein. So higher protein, lower carbohydrate, but the healthy carbs or greens on your plate, or perhaps as long as you're responding well to carbohydrates like black beans or legumes, brown rice, quinoa. So rather than breads and flour products or white rice. So healthy carbs, lower carb, higher protein, and good fats. And figuring out what works for you, because it's not a cookie cutter protocol for everybody. And then exercise, move. We are too sedentary. So if you find out you have insulin resistance, you can improve that sensitivity of the communication between the insulin and those receptors by walking 20 minutes after meals. I had a patient who did that and she dropped 20 pounds. That was the only change she did in a year, which is a big deal, and improved her insulin sensitivity.
Well, thank you for that. So for you that finding this insightful and helpful, but you're like, oh my gosh, I'm a little lost and I need direction, definitely call us at Alive Holistic Health Clinic and just go to our website, aliveholistichealth.ca. And you can book a treatment or consultation with Dr. Tanya Wild, and you can see our acupuncturist, because acupuncture can help to normalize our parasympathetic and sympathetic nervous system to help with the diabetes and metabolism and hormonal control.
Before we go, maybe you can tell us a little bit, because I was going to ask you, how do we manage type 2 diabetes, or how do we add in acupuncture and Chinese medicine to this picture? Because I don't use personally in my practice TCM anymore. I refer to you guys as the experts, but I do recall something about spleen, qi deficiency, or like nourishing the spleen, liver, kidney, organs. Can you just speak to that for a moment before we go?
Okay. All right. Because we have another podcast, but that's okay. So yeah, acupuncture can be used like it's a whole systems medicine, guys.
I know.
So really it's traditional Chinese medicine, which includes the whole lifestyle piece that we were already talking about. Acupuncture is one of the modalities as part of this. And same with Chinese herbal medicine. It's another piece of the pie. And same with what we were talking about before, like sleep and exercise and how we eat and how we move. So when it comes to diabetes, you're right. We typically look at the spleen. The energy of the spleen, we say, helps to take what you have, like what you ingest, and it will transform it into nutritive bits so that your body can absorb it and then take away and get rid of the unnecessary bits so then it'll be processed and goes down and out through your intestines. So when it's functioning well, then the system will go smoothly. Your metabolism's nice. You digest well. You don't get that, tired couch potato feeling, as you mentioned earlier. But when there's a compromise, and sometimes that can be over like a lifetime of worries, the associative, the emotion that goes along with the spleen and stomach for that digestion is worry. So when we have brooding thoughts and like internalized emotions and just churning it inside our heads over and over time, it can impact our digestive abilities and decrease our spleen qi energy, which can cause what we call dampness. Diabetes can be a dampness condition. So if you think of our body as, 70% water, we want it to literally flow like streams of water and not coagulate and be, this marshy bog, which can be what you describe as that belly weight. So we want to have it moving. So we move the qi with the acupuncture points. We move the qi and drain the dampness with acupuncture points and herbal medicine, and even in the types of food that we eat. So I think that will deserve another topic. And, actually, it's not going to be till next year unless someone will request it, because we're going to go through the different elements, the 5 elements. And one of them is the earth element, which is associated with the spleen, which can be associated with diabetes. So that's a whole different discussion. We can't wait to speak to this more. And you're going to go back because we spoke to the metal element, which is about the element of the fall. So go back to that podcast and you'll find out more information.